for joining today's session. So my talk will focus on how we can use biostimulation to rejuvenate the skin in a way that respects its biology, but also enhancing natural repair rather than masking the aging. So we'll explore together clinical mechanisms, protocols, and how I personally integrate these methods in my daily practice. So these are my disclosures. So this webinar is organized and supported by Swissell. And if you have any kind of questions, please put them in the Q&A session so we can answer them later. So my name is Timur Taskesen. I'm head dermatologist at Dermaesthetic Healthcare in Zurich. My work focuses mainly on general medical, but also on aesthetic dermatology and regenerative medicine. I lecture regularly at international congresses, and my academic background is in biology and medicine. So it's always nice to bring science into medical trainings. So patients today, as you know yourself, are asking for natural, minimal invasive results, but also with quick recovery, but they want long-term effects. So the global shift towards regenerative medicine using science to restore the cells and body's physiology and not only volume. So our philosophy is glow up rather than blow up. So we're stimulating repair and not inflating faces. Aging, as you know, begins with slower fibroblast proliferation and reduced collagen synthesis as a result of this. So structural degradation of the extracellular matrix is the result. So it leads to visible signs like loss of elasticity, of wrinkling, and of volume depletion. So understanding this cellular biology allows us to target the cause and not only the symptom. Skin aging is just like a big word. So it combines cellular senescence. So it is just like our own body's clock that we get older, and we cannot stop this. So day by day, we're getting older, but there's also a matrix breakdown. So in youthful skin, fibroblasts remain stretched within an intact collagen matrix. As we age, it is changing. And so in aged or photodamaged skin, collagen fragmentation collapses and reduces. So this is a process while we have to kind of help the fibroblast activity, but also the ECM, so the extracellular matrix components, to hydrate again, to refine its elasticity, but also gradually diminish also this aging process. And this is why biostimulation is so important. So CELLBOOSTER LIFT, the go-to product when you want to kind of help the extracellular matrix to reset, is a CE marked injectable containing high molecular weight HA, amino acids, and vitamins. So it's designed for the remodeling of the dermis. It's made to keep the hydration inside of the skin and also to help the cellular repair. So reaching both superficial and deep layers of the skin. It is a, so to say, redensifying skin booster, which is a balanced mix of the HA, the vitamins, and the amino acids. So together they work to improve the tissue's structure, but also the resilience and the metabolic function. So CELLBOOSTER LIFT works in 4 key ways. So first is the redensification of the extracellular matrix. Second is the cellular renewal via the vitamin-induced metabolism. Third is the improved microcirculation and the oxygen delivery. And fourth, it's the antioxidant and anti-inflammatory effects through vitamin C and the synergy of the amino acids. So this special formula supports what we call biological priming. So it is kind of conditioning the ECM for a better regeneration. So it provides the nutrients, it protects the cells, and it boosts the fibroblasts' performance. So essentially, it's kind of reactivating the dermal ecosystem. So studies show that fibroblast activity can be reawakened, and there are really nice works which are just like also have been published recently, which show that through the key amino acids, the proteins and antioxidants. So we're not kind of forcing volume to stretch them, while we're more kind of reactivating the biological dialogue between the dermis and also increasing the collagen and the fibronectin. So it is how my colleague just like truly said, we're kind of helping the cell's communication to speak the same language again. So this is where this kind of metabolic priming with cell booster lift becomes so crucial, because we're not only stimulating, not only even mechanically, but we're kind of supplying their biochemical fuel. So here are the ingredients again. So vitamin C, vitamin B2, vitamin E, arginine as a strong protein. So these are just like powerful antioxidant cofactors. So, and they neutralize the oxidative stress. The heart of Cell Booster is the SHAC technology. So SHAC technology stabilizes the HA by molecularly linking it to active ingredients. So this ensures a longer bioavailability, a resistance to degradation, and a targeted interaction with the cell receptors. So it's a kind of sustained regenerative response. In clinical trials, Cell Booster Lift significantly improved skin viscoelasticity, skin density, and also hydration. So these data confirm what we see in daily practice. There's an improvement over time, and it's getting better and better. So the protocol goes in like this. So it includes usually 3 initial sessions spaced 2 to 3 weeks apart, followed by a maintenance every 6, 8, 12 weeks, depending a little bit also on the age of the patient, if it is intrinsic or extrinsic aging, or if you just have also thin skin or thick skin. The techniques vary. So you can do it by papulas, you can do it with fanning, you can do retrograde linear, or you can do microboluses. It depends a little bit on the area of the treatment and also on the skin's condition. So for folds, for example, for the nasolabial fold, it's just like I use the retrograde linear technique, parallel 30 degrees to the skin, and then small aliquots line, maybe just like 0.5 per line to provide just like a smooth integration and just like a fence-like way to put it inside of the skin. So, you know, acne scars remain one of the most complex challenges in dermatology and also in aesthetic medicine. So affecting up to 80% of young adults. So the majority are atrophic scars and resulting from the chronic inflammation and the ECM breakdown. So you notice everything comes down to the ECM. And persistent inflammation activates MMPs, breaking down collagen, weakening the dermal support, and then you develop these atrophic scars. So when fibroblast activity here as well fails to remodel, even in the younger skin, the skin collapses into depressions and then our scar forms. Here you have again a show of the different atrophic scars: ice pick, box scar, or rolling scar. Why is Cell Booster so good for these kind of scars? Because it directly injects the regenerative compounds into the scar tissue, so promoting collagen renewal, hydration, and elasticity. And which is by far the most important thing for us doctors, it's safe. It's minimal invasive, and it synergizes perfectly with the lasers, with microneedling, with subcision, with everything that you have on your hands. So over time, the skin improves and the patients are happy. So for optimal results, we developed a dual layer approach. So for the reticular dermis, you can go in with a cannula for the rolling scars to kind of lift and smoothen it out. For the papillary dermis, the needle is better, mainly for the box scars to kind of tighten and refine the texture. And in the dermal epidermal junction, the nappage technique is best for the tone and the pigmentation improvement. So each scar demands precision. So I would say a good combination is ice pick, deep microbolus, and RF or microneedling standalone. Rolling scars, cannula with retrograde fanning, and the box scar, intradermal papules and subcision. So it's always good to kind of have an effective scar remodeling, and you have to personalize the treatment to each patient. So combining, for example, subcision and injection in one step delivers just like mechanical and biochemical synergy. So it releases the fibrotic bands while simultaneously stimulating neocollagenesis. So here are real patient outcomes, also from colleagues from Turkey, and you can observe in the pictures the significant improvement in surface smoothness, in depth reduction, and also in overall tone. And this is just like how safe this method just works. So to summarize, Cell Booster Lift works effectively for all atrophic acne scars. It works perfectly fine to rejuvenate the skin. The dual layer technique addresses both the structure and the appearance. It works synergistically with every energy-based device, and clinical studies also confirm safety and efficacy. So what more do we need? This is also a nice protocol which we developed together with Dr. Gabriel Sekir. And this shows how to integrate, for example, if the patients are possible to use with the IPL, so with the intense pulse laser and the cell booster lift. So perform the IPL to target pigmentation or vascular issues. And after 15 minutes of cooling, you can just like use Cell Booster Lift with a cannula or with a needle, depending on what you want to achieve. So this sequence enhances both the collagen remodeling and the overall skin tone as well. And again, the treatment is well tolerated, so the people have minimal downtime. And when we go back to the start of this webinar, you know, people are asking for minimal downtime, long time results, and also just like no kind of pain. And with this Cell Booster Lift treatment, there are no reported adverse events, and it is also safe for almost all skin types, Fitzpatrick 1 to 5, and it's ideal even for sensitive skin patients. So even if you have patients with atopic dermatitis, it's a really nice product to use. So here we see how different combination strategies work together. So subcision and cell booster lift for structural correction. Laser and cell booster lift for faster recovery, for improved texture. So each method kind of complements the other in a biological way. Even for microneedling and cell booster lift, you have an enhanced regeneration. So here we see also a nice option using cell booster before and after, and to kind of reduce post-treatment inflammation and support the healing. So with the RF microneedling, we'll get just like a controlled wound, which triggers the collagen remodeling in a kind of mechanical and heat-induced way. And after the cooling phase, we can inject the cell booster to kind of accelerate the recovery and together to redefine the tissue architecture kind of way from within. So when we combine cell booster with biostimulators, as you can see here in this slide, it's always, or even just like with an energy-based device, it's always just like the skin receives a kind of multi-dimensional stimulus. So it means enhanced collagen, antioxidant protection, improved elasticity, and faster recovery with less downtime. So it's all about the synergy supporting both structure and the cellular health. So the cell booster formulations contain stabilized, non-cross-linked HA, enriched with vitamins, amino acids, and antioxidants. So they act, for me, as a kind of nutrient primers, enhancing the fibroblasts' span to produce, but also kind of protecting the ECM from the oxidative stress and perfectly preparing the skin for the regenerative stimuli, so as lasers or biostimulators. So this concept mirrors, for me, just like the principles of regenerative medicine. So first, optimize the microenvironment and then stimulate and repair. But you know, this is a needed kind of way because this early inflammatory phase is essential. What we need to be sure of is just that we do not trigger too much of this inflammative cytokines, but it is just like for the biochemical signaling, it is just like important to kind of wake up the fibroblasts so that they know that they need to produce something. So cell boosters metabolic components, such the vitamins, the amino acids, the minerals, they directly support this activation stage. And by this, we can also have a nicer and better way of the collagen transcription and less inflammation. And you know, the damage stimulates the repair, but the support is needed. So this is why I see them as a nutrient primer. So enhancing the fibroblast's activity to protect it from stress and to prepare for more. So to optimize the results, it is always just like to give cell booster before and after every stimulatory procedure. So prepare and support regeneration with cell booster. And why should we do it? Because again, it is enriched with vitamins, with amino acids, with antioxidants. And so it kind of helps the environment and of the fibroblasts, and this primes the effect and it minimizes the stress and the inflammation. So we ensure a more balanced response. So you can use it together with everything that you have just like in your portfolio. And this is always what I tend to teach. And sometimes I feel like I preach already kind of these methods. So you use it together with everything that you just have in your cupboard. So the cross-linked HA fillers, they are very important, and we do not have to be afraid of these HA fillers only because the people are afraid of kind of overfilled and puffy faces, because we need them to create the structure. We need cross-linked HA fillers for the volume, but the cell booster works differently because it kind of nourishes the surrounding dermis. It also thickens the dermis and it has a really good effect on the skin, but the HA fillers, the cross-linked HA fillers, have a different kind of idea behind. But the synergy of them together, this improves hydration, it improves the ECM turnover, it stabilizes even the results of the filler. So you need less, and you can just like also reassure your patient that we can develop a nice effect with less product. And it enhances the elasticity. So it is proven by studies. And by optimizing the environment, as I said before, the outcomes of the filler become smoother and longer lasting. Same also for the biostimulators. So PLLA stimulates the fibroplasia through a controlled inflammatory cascade. And depending on what kind of product you use, sometimes the inflammation can be very high. So Cell Booster comes in to kind of extinguish the fire, but not stop the process of the collagen production. And it helps to shorten the recovery for the patient, and this enhances the safety of the patient. CAHA, so calcium hydroxylapatite. It's also a good synergy with Cell Booster because CAHA provides the deep structural support and it stimulates the collagen. And the Cell Booster complements this by giving the nutrients to kind of help to build up better collagen with the amino acids that are then there. So the result is more uniform deposition of the collagen, not just like scar-like tissue, and better tissue elasticity, and also a smoother integration of the CAHA microspheres. So always together. And you will see later on also protocols how to kind of use this synergy. So with the EBDs, energy-based devices like radio frequency, like lasers, like fractional laser, IPL, you name it. Applying Cell Booster before and after reduces inflammation, provides essential cofactors for the buildup of collagen, so vitamin C, proline, zinc, and it supports also the faster recovery. It reduces the risk of post-inflammatory hyperpigmentation, which you might get after the lasers or after EBDs, and it enhances also the collagen for tighter and more resilient skin. So combining cell boosters is with EBDs or with biostimulators is sequential, and this is something that it also kind of mirrors the body's physiology. So prime, stimulate, and remodel. So this approach kind of is something supporting a cellular metabolism. So the results are longer lasting, they are more natural with fewer inflammatory side effects. And there's new evidence also. So it's great that the group around Adel et al. And also my great friend and colleague Nenad Stankovic published recently a study which showed even the histological proof that combining cell booster with polycaprolactone microspheres accelerates the wound healing. So within even just like 7 days, the combination group of cell booster lift and PCL showed organized granulation tissue and fewer inflammatory cells. So it proves the concept that we've been talking about. And by day 14, the most mature collagen network was already built up. So clinically, this confirms our observation. So metabolic hyaluronic acid, cell booster, priming and enhancing the scaffold-based regeneration. And this is something that is really great. So it even shows in the histological parts that there is a synergy. It's real, it's measurable, and it increases the epithelial thickness. It boosts collagen and demonstrating both anti-inflammatory and pro-regenerative synergy. So great job, guys. Great publication. So it always comes back to kind of how to do it. So the treatment protocols I provide my patients with is to begin with cell booster 2 weeks before structural fillers, biostimulators, or EBDs. Then inject PLLA, KAHA, PCL, HA to trigger the collagen synthesis, and then follow the maintenance with cell booster every 4 weeks, 6 weeks, 8 weeks, depending on how often you want to do it. But always think about also the injection protocols for the products themselves. So do not over-inject either KAHA nor PLLA. So please follow also there the guidelines. So the fibroblasts work also not around the clock. So they need time. So activation of a fibroblast takes about like 1 to 4 weeks. And this is just like mainly Cell Booster Lift's job to kind of waken it up, to help it to synthesize within a week, within a month. And then the fibril organization that starts when they kind of build up and not lying around, so they kind of need to interact with each other, then this takes about 3 months. And this is what I tell my patients as well. So visible, even sometimes the remodeling at 6 months. So the sequential and layered approach mirrors this kind of physiology. Here are also nice results of combined approach of hyaluronic acid and cell booster lift. So sometimes the results are subtle, but you can see less inflammation in the skin, more reflection on the skin, and also just like reduced irritation and also better integration of the filler with the patients. And also combination, for example, of cell boosters and KAHA. So studies confirm that combining hyaluronic acid and calcium hydroxylapatite enhance hydration and enhance the collagen synthesis. So cell booster lift as a maintenance layer after diluted KAHA to kind of sustain the regeneration between the sessions. So cell booster shape. Cell booster shape, metabolic skin booster. So it's designed for contour refinement, for localized fat reduction, but also just like for lymphatic activation. Again, through the shock technology, it is stabilized and it enhances the way how it acts. So cell booster shape kind of supports the biostimulation. And by this, it also boosts not only the fat metabolism, but it also helps to kind of kick in with the collagen synthesis simultaneously. So it addresses both structure and metabolism in one go. So mechanisms of action of cell booster shape is hydration and restoration, support of the fat metabolism and the drainage, vitamin C for the collagen, and also as an antioxidant defense. And together with L-carnitine and vitamin C, you have a stronger lymph angiogenesis. So new lymph vessels are just like made. And by this, they reduce puffiness, especially just like in certain areas. So main indications are malar bags, facial puffiness, but also just like submantle fullness and cellulite. And it's highly effective for contour, but also just like essentially anywhere you need to enhance tone and drainage. I alternate between intradermal papules and subcutaneous cannula techniques. It depends a little bit also just like on the areas, also how much I use. So for me, for example, for periorbital edema, small amounts, just like 0.1 papules per point are sufficient enough. So total about maybe 0.4 per site, and then you don't need more to have a really good result. So the next slides kind of illustrate the typical treatment zones for under eyes, submental, cheek, neck, but also full face correction is possible. And shape is really great product to kind of manage not only just like the gravitational ptosis and the edema tendency, but also what I saw in my patients exactly just like also with combined approach is the change of the pastosity of the skin, reduction of sebum, with elderly male patients even. And on the neck, it also helps to restore not only the tone, but also the texture, and it reduces puffiness. So it's just like great, great results. And this nice technique, Dr. Sekir and me developed is also just like also for fat protrusion under the eye. But now I'm not only injecting deep, I'm injecting very superficial and still get really great results with it. So you see these injection techniques and you see how superficial we are injecting in the under eye area. And this is what I meant per point 0.1 maximum, 4 points, and you will have a nice effect for the lymphatic drainage, but also with the HA for the rejuvenation of the periocular region. Also great results from colleagues from Italy. Again, also combined results with cell booster shape, cell booster glow for the periorbital region, reduce inflammation. You see how the redness has gone down. You see the pigmentation has gone down. And also you can see even the small crow's feet that have gone down over the time, which is great. And even just like possible without using Botox. Also great results. Here, the bags reduced after sessions with cell booster shape. And on the neck, for example, 2 or 3 sessions restore the tone and the texture while reducing puffiness. And have a look, maybe you'll recognize this is me on the video. And as a male patient, I'm not really pain resistant. So, but this treatment is not that painful. So this is a really, really great protocol for the reduction of the nasolabial fat pad. And this is shown by fellow colleague Dr. Raul Vanegas from Argentina, and he developed like a precise technique to reduce the nasolabial fat pad. So this is something that persists with age, and you can see in his videos later how to mark the boundaries and how to inject just like in a special way. And then you should repeat it after 10 to 15 days, 3 to 4 sessions to rebalance the facial contours without the need of something else. So this is just like a very precise technique, an area which is just like usually hard to treat, and usually people are afraid that we overfill them in these areas. So he marks the fold boundaries. Out of time reasons, I'm going to fast forward a little bit. Then he injects subcutaneously at approximately maybe, I would say, 5 millimeters depth using a kind of fanning pattern. And then he's massaging it gently. So here we are using cell booster shapes effect to reduce the fat protrusion, but also kind of helping. And you see that was just like 1 ampule, so 3 ml on one side. But you will see now in the video that after the gentle massage, you can see the difference between both sides. Sure, mainly it's just like the direct effect of the volume, but later on when you kind of repeat that every 10 to 15 days for 3 or 4 sessions, you will kind of rebalance the facial contours. So really nice one. So the next slides will kind of illustrate the typical treatment zones, but also just like for the full face correction. So this is something that is great. And here are, for example, my Zurich cases. So after 2 sessions, 2 weeks apart, so only 1 month in between, it's just like great because you can appreciate not only the reduced puffiness but also just like a tightening, lifting effect, and also just like reduction of the sebum. So it's great to see the improvement of the lower face. And this is something that the patients are happy about. And this is done by shape and shape only. So I see even in the pictures, you see the quality of the skin is just like visible. So it kind of rejuvenates the appearance without looking odd or different. Also with male patients. So they never want to look corrected, they never want to look overdone, and you can see nice reduction of the sebum. Also, yes, definitely here on the side, and you can see also the kind of reduction of the facial, I would say maybe discoloration, and this is something that is just like perfectly fine, and also just like reduction of the pastosity of the skin. Same also here with this beautiful patient. You can see the reduction of the erythema. You can see the reduction of the pastosity. You can see also even the reduction of pigmentation. And this is where we come back to the communication between the cells, because Cell Booster kind of facilitates the speaking language. And Cell Booster Shape, as all Swiss Cell Booster product, is a Class 3 CE marked medical device. So it's made to be injected. It has minimal side effects. It has no downtime almost, and it shows consistent results. And so the following patient cases um, show just like also a really nice result. And combining Cell Booster Shape with PLLA, with HA fillers, with KAHA, is just like something that comes to mind directly. So, these allows us to cover the entire architecture of the skin. So from metabolism to matrix to structure. So each modality kind of amplifies the other's signal, and by this, it always also is better. And there's a scientific support behind this synergy. And so we know it works also from a scientific level. And so we come back to prepare, maintain, and to stimulate. So we'll have a pre-treatment with Cell Booster Shape 2 weeks before the priming, this nutrient priming, as I said, then injecting the biostimulator for the structural stimulation, and post-treatment to maintain the balance and to prolong the results. So again, nice cases from Zurich showing the combined use of Cell Booster Shape and biostimulators. And you can also see it's only 2 months apart. And you can see this is kind of regeneration in action. So, I mean, mechanical, thermal, and biochemically working just like a concert. So, because I did inject Cell Booster, I injected PLLA, and I did a fractional laser. So it is just like a loud concert going on in the skin, but see what did it and see how nice the skin looks. And this is something that you can all achieve by using the cell booster in combination with all that you have on your hands. So what's the next step? So, last week I came across the Yamanaka proteins and I felt like, okay, wow, this is a great step to kind of be able to reset the clock of the cell's biology by helping the skin to reset that. So we're not there yet, but we have something in our hands which works in a kind of similar way. So I think these are just like the next focuses to expand the indications for cell booster shape, but also to kind of conclude that cell booster shape is not only a metabolic skin optimizer, skin booster. It is just like a regenerative skin therapy for me. So it works synergistically with all the other injectables and devices. It is safe, it is effective, and it is also well tolerated. So I think we're moving from correction to optimization and from volume to kind of vitality. So regeneration is not only about collagen, it's about restoring the communication between the fibroblasts and their matrix, and how to do it easier when you just have a very safe product on your hand, just like Cell Booster. So my advice, broaden your treatment portfolio with these bioregenerative injectables, achieve faster, longer lasting results through smart combination of the protocols, and you see what's possible and you see that there's a scientific backup. And by this, you will always stay ahead because you will align with the skin's biology, which is very, very important, because I think true regeneration, just like usually, always comes from within. So thank you very much for for your attention. And just like the last words, I think just like regenerative aesthetics is just like mainly about balance. It's not only triggering the injury, but also supporting the recovery. So Cell Booster kind of bridges the gap between stimulation and restoration to kind of optimize the tissue metabolism for a safer and a longer lasting effect. So as I also wrote down, so prime the matrix, respect the biology, and the results will follow. So thank you very much. If there are any questions, please don't hesitate to put them in the Q&A section, and then also just like come to us and also see what's possible. Now, I'm just going to have a look. I'm just going to answer quickly some of the questions. So here's a nice question. Do you recommend using cell boosters and exosomes together in one session? So I think, to be honest, they kind of do the same job. So you can, and there are also just like new products planned from Swisscell, but I would not combine them in one session, but you can. You can use them sequentially. You can also do that, but cell boosters are made to be injected. So when you inject the cell booster, you will have a better result. At the moment, exosomes are only for superficial use, so you can do it in one session. That would be possible. So next question would be, is it suggested to combine cell booster lift and shape together for the sagging fat phase? So I think you got your answer. So yes, you can combine it and you will see it is just like a perfect kind of way to deal with the aging skin, because aging has different kind of modalities, and with the shape you will have a nice way to work against the deformational aging, and cell booster lift will be more for the tightening and repairing. I will not mix it. So inject it separately and you will have different layers where to put it. A maximum dose for shape to inject on the lower flank, it depends on the area. So just like count that, and then you will see how much you need. Sometimes you will need more than one vial for that area. So is it safe to use Cell Booster with other heat-based technologies? So yes, because Cell Booster is quite heat resistant. So if the area where you inject Cell Booster is not going to be heated over 100 degrees Celsius, it's safe to use it together. But I would maybe first start by using the heat-based technology because it's going deeper, and then inject the Cell Booster shape after a cooling period in a layer on top of that. So never treat the same layer at the same time. Can Cell Booster be used in combination with erbium, yttrium, scandium, gallium, garnet laser? So yes. So any EBD you can think of, you can use it. Always think about the layer where you are just like treating, and then just like think about never treat the same layer and the same session, but you can use it in combination. Good. So combination cell booster with collagen type 1. So it's just like there are some things on the market, but I would say, sure, you can. Cell booster will kind of, as I said before, would be just like the nutrient primer. And so it will prime the matrix to kind of make your own collagen and make better collagen. If you want to help and bridge the gap time in between. And this is what I also said before, because it takes time for the collagen to form. And this is something which we should never lose out of sight. So it will take some time to get there. And you can bridge that time if you want with collagen type 1 products. What kind of cell booster do you recommend for underneath area? So what kind of area do you mean? Do you mean just like the nether regions, so inguinal part, or I don't understand what's underneath area. What does that mean? If you are asking about maybe pigmentation in the groin area, or maybe just like also in the vagina area, or maybe scrotal area, you can use Cell Booster Glow for this in a very, very nice way. The only thing is just like it will be a little bit painful because you're going to inject it very superficially. So what about Cell Booster Hair in combination with polynucleotides and hair treatments? Great, it works. I would do it as I do with the PRP, as I do it with other treatments. So cell booster hair inject, and then the polynucleotides need to be injected as well. So gap it. So cell booster lift, cell booster hair. 2 weeks later, the polynucleotides if you want. Then 2 weeks later, again the cell booster hair, because they do a different kind of job. No? So one is kind of accelerating the signal to repair, and the other one is providing the ECM and also just like micronutrients, vitamins for the follicular growth. So questions on Borush. So if combined with PCL, do you use it as the same session? Yes. Yes. So same session, injecting PCL and cell booster lift. So after peeling, can I inject, lift, or shape? Well, it depends a little bit on what you want to achieve. So if the peeling is made, for example, for acne scars, use cell booster lift. If the peeling is made for the pastosity and for the sebum, use cell booster shape. As I said, in a full face correction option. So that's possible. And if the peeling is done for pigmentation, use cell booster glow. So it depends on what you want to achieve, but it's possible and it's advisable as well. Good. What rhythm of treatments would you recommend in combination of fractional laser and cell booster glow? So fractional laser, it's also just like, because it's, if you mean it just like, for example, an erbium YAG or a CO2 fractional laser, this is gonna be a very tough one for the skin. So the skin kind of needs to repair itself. And so it takes time to have that kind of remodeling. So wait. So I would say a laser 6 weeks, 8 weeks in between, and depending on also if you want to do it, for example, for the acne scars or even for rejuvenation, gap a time between. But then you can do the cell booster, as I said before, prime it 2 weeks before, do the laser, 4 weeks later again, for example, then the cell booster, then the laser again after 6 or 8 weeks, and then again the kind of help with the maintenance with or post-treatment with a cell booster. So to kind of maintain this kind of cyclic approach, and this is for the extension of the results and support of the long-term health of the skin. So underneath the eye area, okay, now I got it. No, so you mean the area here. So it depends a little bit on what you want to achieve. So if it's for structural support, use cell booster lift. If it's for fat protrusion, or if it's just like to even out the lines, then you can also use cell booster shape, very superficial. It's also possible. And if it's for the fat protrusion, deep, use cell booster shape. And if you want to conquer dark circles, use cell booster glow. Again, think about what you want to achieve and think about the layer where to inject it. I think for the mother bags, I think we showed something in just like in the presentation, but it's possible that we maybe I can include some more pictures around that. So yes, uh, the question from Agneta, it gets better and better over time. So it is kind of helping to for a deep stimulation, for a deep hydration, for activation of the fibroblasts. And by this, you kind of maintain the cycle, and maintenance always means sustainable collagen formation, better antioxidant defense, and more hydration. So it will be a long-term dermal health. Yeah, can Cellbooster Glow be used for post-inflammatory hyperpigmentation? Yes, It can be used for this. No? It will help to reduce it. It will might not make it go away, but sometimes you need to also, just like after vascular treatments, you might need also just like a different kind of laser to reduce that. No? It will not help if you had just like, for example, iron infusions and then the iron came out. This will not work, unfortunately. Can I combine cell booster lift with PCL? Yes. Great study been performed by Adel et al. So read it. It's possible to combine it. Can I mix baby Botox with shape? So whatever you do in your own kitchen is up to you. So um, it's off label, but it's possible. Yes. Well, this is a nice question, but how many sessions needed for optimal effect? So again, so think about the stimulation of the collagen fibrils. So 4 weeks to activate it, 3 months to synthesize it, and 3 to 6 months to kind of remodel it. So the fibroblasts need time. So it will not be just like within a month. So it takes time. And so it depends on what you mean as an optimal result. But usually you get real nice results after 3 months. So maybe one last question. Is reducing the volume of fat pads through mesotherapy a goal in the herniation of jowl fat pads? So when we inject cell booster shape, just like my colleague from Argentina did, it is just like we reduce the amount of fat there by mobilizing the fat. So it will be just like kind of internally burned away. And this will also then reduce the kind of downwards fat protrusion. And so it will kind of help with this. So it is a way to reduce it, yes, but then you also have to think about not only the fat pads that age, but also just like about the ligaments and the muscles. So you might need a support in this area, for example, with a volumizing filler. But that's the idea, the goal behind it, yes. So thank you very much for these great questions, and thank you very much also for um, staying with us until the end. And so if there are any kind of questions, then please do not hesitate to ask us or your provider. And I hopefully see you soon again. Bye.